I don't think I'd be here if it wasn't for Raglan. 100%, just wouldn't. I wouldn't have lasted. With my illness and the things I thought and the things I believed that could happen, I wouldn't be here.
Probably on the streets or probably in prison or anything. Not in a good place anyway.
Be at a standstill on another unit. And I actually come to the Fountains a day after my sister's funeral. Just being able to come here, and it was so soon after, but it was a fresh place, it was a fresh start, I was supported by the team. I think if I hadn't have had that, I think my mental health would have relapsed.
I'd still be chaotic, really poorly. I wouldn't have a life at all. Raglan really helped me.
At Cygnet, we believe that recovery is not a journey taken alone. It is a path of empowerment, independence, and hope. Our aim is to support people as close to home as possible. Maintaining contact with family, friends, and support networks is a vital part of each person's recovery. With 22 services across the UK, more than 72% of patients in Cygnet's rehabilitation settings are within an hour's travel from their home. Our model of care involves family, service users, commissioners, and carers. This collaborative approach enables us to create personalised care plans tailored to the needs of each individual. Our multidisciplinary teams equip people with the skills they need to not only survive, but thrive in the community by practicing everyday life skills, accessing education and vocational training, volunteering in the community, working with people at their own pace, with the aim of living independently and giving people a sense of purpose.
I've probably learned more in a rehab than I have in my years climbing up from acute to medium, but the skills that I've learned here that they've provided for me, it's set me up now for my future, it really has.
Individuals in our care saw an average 66% increase in their daily living skills between admission and discharge, this contributing to their success in stepping down. Between September 2023 and September 2024, 76% of individuals discharged stepped down along their care pathway into the community. When community provision is stretched, mental health rehab gives people access to the support they need from teams of professionals, preventing the revolving door of acute readmissions.
I just think if I'd have been put into the community without coming into a rehab, even though I thought I didn't need it, I think there'd have probably been a high possibility that my mental health would have relapsed, because I'd have felt isolated, I wouldn't have had the skills, and I'd have probably ended up back in services.
Currently, the average length of stay in our rehabilitation services is 18 months, and in the last 5 years, we have been able to reduce the length of stay by over 6 months. Cygnet also provides a transitional discharge to assess service. This is suitable for those who no longer require an acute or PICU admission, but still need support before they are discharged into the community or to their next care setting. This step helps free up beds on acute wards for those needing more intensive care, and also represents a cost saving to the NHS. The average length of stay for our discharge to assess admissions is 48 days. Our staff are the driving force behind our care, making a meaningful difference each day. With expertise and compassion, they walk alongside each individual, offering guidance and support every step of the way on their journey to recovery.
The staff in here have really helped. You know, people are kind and caring, they understand, and they just make you feel safe.
They'd focus on you as an individual. When I've been in other services, you're kind of looked at as a number or a group.
It's a bit weird, but I love it here. When I come back, I say I'm going home. It feels warm, you know, when you come back.
The care that I've received, it's just been outstanding. It's changed my life coming here, it really has.
The benefits of our services extend far beyond the individual. For families, it means restored relationships. For communities, it results in fewer hospital admissions and more people living fulfilling lives. For the economy, it means more people can contribute productively to society. Our rehabilitation services are more than treatment. They are about transforming lives. Every skill learned, every milestone reached, strengthens the wider community and creates a ripple of positive change. Cygnet Healthcare, supporting recovery, restoring independence, improving lives together.